I'm going to talk to you today about depression in women with cardiovascular disease. Depression is predicted to be the second most frequent cause of disability in the world by 2020. Now, especially after today, when the women in the audience had all this gloom and doom from all the cardiologists, and let me tell you, the only bright point in my afternoon was hearing Naomi Rappaport talking about young women under the age of 64. Thank you for that. Now, mental health issues are often the elephant in the room. And I'm sure this is why I'm the one who is always the last speaker. And in fact, just before this talk, Professor Munger was saying to me, the problem with you psychiatrists is that you don't have a high enough profile. Now, I don't know. These elephants are quite high-profile things. But diseases of lifestyle are now receiving the importance that they have deserved for many years. And of these, cardiac disease is highly prevalent. There's a strong association between cardiac disease and depression. And this link is a two-way street. What I mean is people who are depressed have an increased incidence of cardiovascular disease, while people who have cardiac disease also have an increased rate of depression. And in fact, that rate is said to be 20 to 40% according to some studies. These people meet the full criteria for major depressive disorders, while 30 to 45% have significant symptoms of depression. Now at this stage, maybe just to pause a little bit and to talk about what is depression, because certainly psychiatrists know what depression are, but a lot of other people, including other medical specialists, don't know what depression is. And depression is not sadness. Everybody has moments of feeling a little bit down and feeling, that life is awful. But for you to be diagnosed with depression, you have to have 10 days of continuous depressed mood for most of the day, a sense of loss of pleasure from usual activities, sleep disturbances, which either can be less or more, appetite disturbances, again, can be less or more, a loss of energy, poor concentration, and some other symptoms. But for me, these are the most important ones. Too many people, I think, say to people, how are you feeling? And they say, I'm feeling depressed. And they move on and they accept that that is depression. Now, what about the incidence of depression in females? Depression is not a female disease. Some males think it is, but it's not. There's no evidence that there is a high incidence of depression in females than males in general, because males tend to underreport symptoms, and also they don't seek treatment for depression. Some kind of tough guy thing, they have to work through it themselves, and all these terms that we hear all the time. What makes the difference is that there can be no doubt that there is the hormonal effect. There can be no debate that females have increased rates of depression associated with menstruation, pregnancy, childbirth, and menopause. And it is particularly around the time of the menopause that women start catching up to the male risk rates for myocardial infarctions. So what? You know all this. Apart from Eckhart, who's writing it all down. What hasn't been recognized, and what is very important, is the role of the anxiety disorders. The Y study, which is the Women's Ischemia Syndrome Evaluation Study, found that symptoms of depression and anxiety overlap. They are independent predictors of cardiovascular disease, and together they make a more powerful team. So in this study it was about a 6-year follow-up study. They had 489 females who they studied using coronary angiograms, cardiovascular risk factor assessment, and question-based evaluations of depression and anxiety. And for that they used the Beck Depression Scale and the State Trait Anxiety Inventory. Now these females were followed up for more or less 6 years. It was 5.9 or something. And they then looked at what kind of cardiovascular disease they developed. Of these, 15.3% or 75 experienced a cardiovascular event. And of those, 18 died of cardiovascular causes. Depression scores were found to be significant predictors of cardiovascular disease outcome, especially if the anxiety scores were added. Now, what is anxiety again? Is anxiety something that if you have to give a talk like today that you feel a little bit tense, maybe you don't sleep so well at night? Is anxiety the feeling you have when you're having to write exams? Is it the feeling you have when you have to go on a social occasion and meet new people? Is it something you have when you have to go outside of the comfort of your house? In fact, anxiety, as opposed to depression, is all of those things. Anxiety is massively underdiagnosed in people. And in fact, in my daily practice, I meet people and often I think, you know, only if they could take something for their anxiety, they'd be so much more functional people. And even their close relatives don't recognize the anxiety. So anxiety is what we here in this group now, where we're talking about cardiovascular disease, will be called the hidden killer. Now, again, this isn't really new information, because from the time of the Greeks, there was something called negative emotions. And these were thought to play a role in the causation of physical illness. Not just in case of cardiac disease, but in case of all kinds of diseases, and in particular now in what we would call the diseases of lifestyle. It's not clear how these kinds of psychiatric conditions bring about this negative effect on cardiac and other diseases. So whether there are actual physiological changes that occur, or whether there is simply a similarity of symptoms. So you all know the issue of panic attacks. You all have treated panic attacks. People have palpitations. They feel a tightening of their chest. They become anxious and short of breath. They go to casualty, convinced they're having a heart attack, only to be told, no, in fact, they are having a panic attack. In fact, I was extremely lucky once. I was on an aeroplane, and there was a call, you know, is there a doctor in the plane? So I went along thinking, oh my, poor soul. And it turned out actually to be somebody who was having a panic attack, fortunately for them and for me. So panic attacks are quite common, and they can be quite confused with other conditions. So is that the problem? Or is it simply that there are alterations in the sympathetic nervous system? And perhaps one should be looking at some kind of studies that say, okay, so now we know that anxiety is also involved as a predictor of cardiac disease. So what are we going to do with that information? So surely now all these people that come with panic attacks to the casualties, etc., we should be investigating them and looking at them going forward, something we could quite easily do. So we need more research here. Now what about the treatment of depression and anxiety? Here I'm saying that your referral to psychiatry is better. You know, the psychiatrists are not running around treating cardiac disease, and I think that the cardiologists and physicians shouldn't be running around treating psychiatric conditions, particularly in this instance because of the problem of the psychotropic medications and the side effects they have. So, you know, if you're going to put your cardiac patients on tricyclic antidepressants, reap the consequences, with the emphasis being on the word reap. Most important part for me would be to use the SSRIs, and that is because they have a very good effect on treating the underlying anxiety. And again, you should be using psychotherapy, not only because of the compliance and the lifestyle changes, but the additional advantage of addressing stress coping mechanisms. So to conclude, I'd like you just to look at the slide. Some people cope differently, and this woman, she's coping very well. So here you see a young woman under the age of 64 with her elderly husband. Whenever I get mad at you, you never seem to get upset. How do you manage to control your temper? So her stress release is I just go and clean the toilet. How does that help? I use your toothbrush. Thank you.